Since the beginning of the pandemic, NBC10 has periodically checked in with Temple doctor Jamie Garfield. She's on the front lines in the fight against the coronavirus.
Now, with a record-breaking number of cases, Dr. Garfield is talking about increased hospitalizations, Thanksgiving, and a possible need for another shutdown. NBC10's Rosemary reports.
I wish I never had to take care of another patient with COVID infection, but I understand much more about this disease and how to treat it. And that's reassuring because there was a lot of fear in the beginning that we had no idea what we were doing.
With the record number of COVID cases, Temple doctor Jamie Garfield isn't going to get her wish of not treating another virus-stricken patient.
About a month ago, we had, 3 or 4 or 5 cases in the hospital, like really just so few. And then it's just slowly been increasing. We got to a dozen, we got to 2 dozen, we got to more than that, and yesterday we're at almost 100. That's upsetting because we had this playbook. We knew how this worked, and we thought we could put in place some measures to prevent this from happening again.
The doctor says because not everybody has bought into wearing masks, washing hands, and social distancing, we are seeing community spread. She tells us we may have to take a step back.
I see the benefits of shutting down again, absolutely, in terms of containing the spread. There are some risks to that, but as a doctor, just as a doctor, I think that makes the most sense. I think that makes the most sense to contain this virus is to limit, your contact with other people and, isolate and stay at home or stay among, in a small community of people.
And with Thanksgiving only a few weeks away, the doctor says there are some things to keep in mind.
You have to be mindful of who's coming, who's coming, what the prevalence in the community from where you are and the prevalence in the community of the other folks who are coming to these gatherings so that you get a sense of whether it's likely or less likely that people may be asymptomatic carriers. You need to think about the event itself. So is it indoors? Is it outdoors? How long is it?
While she's hoping these and other gatherings don't mean more COVID cases, she is realistic, and the hospital is preparing.
We're asking ourselves every day, do we have enough ventilators? Do we have enough ICU space? Do we have enough of these drugs? Do we have enough staff? Do we have enough PPE? These are questions that the hospital administrators are asking themselves every single day, and they report every day back to the Temple faculty, that yes, we've got what we need today.
As we see the number of cases go up day to day, Dr. Garfield knows what's coming next.
I anticipate that the next time you and I talk, we'll be talking about the deaths that result from these just tremendous case counts, hospitalizations, and morbidity and mortality.
I'm Rosemary, NBC10 News.